So, definition. Assessing the ear is important about the client's and ability to interact with the environment. So, the main purpose is to get the information about the client's ability to interact with the environment to determine if the patient has the adequate hearing and if he or she presents symptoms of hearing loss. So, the equipment are the otoscope, watch with the second hand for the Rauberg test. So, turning fork. That's it. So the next one is the consideration before, during, and after the procedure. Explain the procedure to the client and make sure that the client is comfortable to promote participation. So, things to document after the procedure. Document all the assessment and result. That's it. So let's proceed to the video assessment.
Inspect the uricles for the position, size, shape, symmetry, and color. Note for the lesion and drainage. This to note for any deviation for the normal color of the surface may indicated order-lining condition. Palpate the uricles for condition of skin, any areas and tenderness. This to assess the signs of lesions of inflammation and infection. Pull the auricle upward, downward, and backward to check the elasticity. So fold the pinna forward and push in the tragus. Apply light pressure on the mucoid process. This to check for any areas of tenderness. Inspect the external ear canal for the cerumen and skin lesion, pus, and blood. This to determine the lecture of the curament to check for any drainage. Using the otoscope, inspect the tympanic membrane. This to visualize the lymphatic membrane. Attach the speculum of the otoscope with the diameter that will fit the ear canal without causing discomfort. This to achieve maximum lesion of the entire canal and lymphatic membrane. Have the client tilt his head to the side not being examined. Inspect for any foreign object in the ear canal before inserting the otoscope. This to avoid discomfort during the process and ensure accurate examination. Pull pinna up then backward. Pull pinna down then backward. This is to strengthen the ear canal, participate vision of the ear canal and the tympanic membrane. Insert the speculum slowly about 1 to 3 into the ear canal. This to inner 1 to 3 canal is bony and the speculum passed against the ear side. The client will be experiencing discomfort. Inspect the tympanic membrane for color and glows. This deviation of normal color in any indicate trauma or infection. Gross hearing acuity test. Assess the client's response to the normal voice tones. This is to determine if the client has normal voice tones. If the client has difficulty hearing the normal voice, proceed with the following test. Whisper test, tuning for fork test. This to assess high frequency hearing, the bone conduction, and air conduction of the client. Perform the whisper test. This is to assess high frequency hearing. Have the client include one ear. This is the best hearing of the ear. Out of the client's sight at the distance of 1 to 2 foot, whisper the simple prayers such as the weather is hot today to determine whether the client will able to repeat the purpose correctly. Ask the client to repeat the praise and this to evaluate whether the client hear the purpose. Repeat with the other ear using a different phrase. This to evaluate whether both ears are okay or not. Tuning fork test. Hold the tuning fork at its base and strike it on the table. This to produce a sound. On the Weber test, this to assess the conduction of the examined. Place the base on the vibration fork on the top of the client head. This to side upward transmission of the sound. Ask the client where he hears the noise and this to determine whether the patient is whether negative or positive. When it tests, strike the tuning fork on the table while it's still vibrating. Place it in the client's mastoid process. This to compare air condition to bone conduction. Measure the time in the seconds that the clients hear the vibration. This to determine whether the client is positive or negative. Strike the tuning fork again and place it about 1 inch away from the client ear and measure the time until the client can no longer hear the vibration. Air conduction should be greater than bone conduction. Repeat it on other ear. This to evaluate each ear separately.